Hello, I'm Michael Kirchgesner, sports massage therapist at MK Sports Massage. Been doing massage therapy for about 11 years now and have a passion to help athletes and weekend warriors perform better and get over their injuries quicker through massage therapy. With me today,
Hey everybody, my name's Staton Rebeck, owner of Revolution Health and Performance. I'm a physical therapist, and much like Michael, I want a way to holistically treat an athlete or active individual. So what we're going to do is show you some approaches how we can do that with physical therapy and massage therapy. Alright, so the injury we're going to be talking about today is a sprained ankle for an athlete or active individual. An assessment as a physical therapist, some things that we look at, and I'll make this pretty abbreviated, are swelling. So we can look at just swelling around the malleoli here, or we can actually do a figure 8 pattern to assess how much edema is in the ankle. The second thing we'll look at is range of motion. So you have plantar flexion, we'll measure this with a goniometer, dorsiflexion, inversion, and eversion. Okay, those are the four main motions of the ankle that we'll look at. We'll measure the degrees or the amount of motion that you have for each of those planes. The third thing we'll look at is strength testing. So if I'm looking at dorsiflexion strength here, I'll have Michael bring his toes up, hold against me, don't let me push you down. Okay, so that's assessing strength there. If I'm assessing more of the inverters, putting strain on these ligaments out here, I'll have him bring his foot in, don't let me push it out. Okay, we typically see some weakness in inversion and potentially eversion with a sprained ankle. The last thing I'd really look at would be functional testing, so things like balance, your ability to potentially hop, squat, single leg squat, but we'll save those for another video.
continuing on with an ankle injury, maybe a sprained ankle, one of the first things you want to do is get ice to it. Icing the area can help with decreasing that inflammation. You can also wrap it with an ACE bandage. You don't want to massage in the first 24 to 48 hours of ankle sprain, ankle injury. There's just so much going on in the ankle that you're gonna probably cause more stress to that injury, to the ligaments, to the muscles that have been injured. Once you've reached that 48 to 72 hours, you can assess the ankle, see how much they can move, how much the client can move. If they can dorsiflex up, plantar flex down, invert, go ahead and invert, and evert. If you can check that they can do those 4 different things, you know that there's not too much swelling in that. If it causes pain, anything above a 6 or a 7, you probably want to hold off the treatment for another day. Once you are ready to treat, simply circular motions in that ankle joint, even doing circles around the malleoli are going to help get blood flow into those tendons, into those ligaments to help that healing process. You have malleoli on each side of the ankle here. I know the video can't see the other side, but as working blood flow into that area, you can come across the fibularis muscles. If those are tight, you're going to want to, if they're too long, we want to shorten it. If they're too short, we're going to want to lengthen it. So a tight muscle you'd want to lengthen. You can do what's called stripping to those fibularis muscles to help with that eversion, and even getting into a little bit of mobilization to help synovial fluid get into that joint, and then reassess and get the treatment you need.
All right, so getting into some of the treatment that you might receive from a physical therapist for an acute ankle sprain, one of the first things we'll likely be doing to restore joint mobility, range of motion, is mobilizations. Dorsiflexion is the motion that's often lost during an ankle sprain due to edema and just the strain on those ligaments. So one of the mobilizations you can do is actually grabbing the foot in this motion, stabilizing with the table or another hand here, and then just lightly working that joint into dorsiflexion. Okay, that's going to help restore some range of motion. The second thing that we'll do is actually start doing some light stability work. So you can do this manually to start out easy, or banded is probably the next step up. I'm going to have Michael bring his foot up into dorsiflexion. Okay, hold against me. If he's holding there for roughly 10 to 20 seconds in a static position, that's what's called an isometric. It's a great exercise to start out, increasing stability in the joint, and actually helps alleviate pain. You can do this in all directions, so plantar flexion, okay, holding resistance there, inversion, okay, holding resistance there, and then eversion, holding resistance there. Once you can tolerate that, you can work into more of a full range of motion, more of a concentric and eccentric action. So if he starts here in dorsiflexion, I'm going to say, hold against me lightly, let me pull you down, but I want it to be more of a resistance on the way down. So hold, okay. That's starting to apply some resistance to those tissues while they are stretching at the same time, more of an eccentric action, okay. Plantar flexion, pushing up as he's resisting, inversion, pushing out as he's resisting, and then eversion, pushing in as he's resisting. So that's something that we can do early on in an acute ankle sprain. After that, we're going to be working more towards functional exercises, things standing, working on balance, proprioception, your body's ability to sense itself in space, and those types of things.
All right, so once you've rehabbed the ankle, once the ankle's better, you want to do some maintenance later on to help prevent this from happening again. Massage is a great way to help maintain muscles that have been injured in the past, or prevent injuries from muscles to strain in the future. So typically, again, you're just doing a typical massage on the ankle, working the different tibialis muscles and the different ligaments and tendons in that area. Great way to help keep from having to deal with an ankle sprain again. Again, we also want to work some of those intrinsic muscles of the foot, help those get involved in the action and movement of the foot, so you're not reliant on all of these bigger muscles, allowing those sometimes smaller muscles to get some blood flow into them to help that foot and ankle act the way we want when we are jumping off of it or stepping from time to time.